Did you know that your tongue, your lips, your orofacial muscles play a huge role in how you breathe? Weak airway muscles can contribute to snoring, sleep apnea, and even chronic stress. Today, I'm going to show you 5 simple daily exercises to help you tone your palate, tongue, and lips to help you breathe better. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center. I like to think about breath and airway as the foundation of our physiology. And then we have our sleep, and then we have our nervous system, and then we have all of our other systems. So if our breath and airway are compromised, then everything else is as well. So our airway is supported by muscles, especially the tongue, the lips, and the soft palate. When these muscles are weak or out of balance, then we tend to mouth breathe, snore, or lose airway tone at night. By retraining our tongue posture, building lip strength, and improving swallowing patterns and even chewing patterns, we can restore nasal breathing, boost oxygen delivery to our tissues, nitric oxide production, and even nervous system regulation. Think about this as fitness training for your airway. Let's dive into the 5-minute daily routine. Number 1 is the tongue to spot reset. So you're going to take your tongue, bring it right behind the top teeth, and there's this little ridge that's called the incisive papilla. I want you to feel that with your tongue because that is the spot. That is where the tip of the tongue should be all of the time. So what we want to start with is having the tip to that spot for at least 30 seconds. Now keep in mind, we want it to be there all day, every day, unless you're talking or eating, but this is a really good starting point. So you want to think about keeping the lips sealed. The teeth are ever so slightly apart, and then you're keeping the tongue there and you're breathing nasally. This is the tongue's natural home, so it helps to lift the palate and keeps your airway open. Ultimately, we're going to move into number 2, which is the tongue suction hold. We're going to work on this for about 30 seconds. So now I want you to think about where that tip of the tongue is. You want to think about bringing the whole tongue to the roof of the mouth. Now, sometimes we have very narrow palates and we have high vaulted palates. So this may be very challenging. So keep that in mind based on your anatomy. However, we ultimately want the tongue to be at the roof of the mouth. So you're going to think about suctioning the tongue as flat as we can make it to the roof of your mouth. And we're going to hold for about 5 to 10 seconds. You're going to release it and then do it again. So hopefully you can start to work up to those 10-second holds, and this is going to help to strengthen the tongue palate seal that helps to tone the airway. Next is a mindful swallow. So I'd like you to take a small sip of water, and as you do that, you can also just generate a little bit of saliva and swallow the saliva. As you're swallowing, I want you to think about keeping the tongue pressed to the spot and swallow without using your lips and your cheeks and compensating in any way. So again, you'll take the sip or you'll just generate some saliva and you're going to bring the tip of the tongue to that spot as you swallow. A lot of times if you look in the mirror, you'll see all kinds of things happening, your cheeks moving, your lips moving, it might compensate to one side. So you want to be able to help to retrain the swallow pattern and coordinate your palate and your throat. So when we're thinking about integrating this into life, ultimately this is how we should be swallowing all the time. The tongue should not thrust forward into the teeth when we're eating or drinking. It should actually come to the roof of the mouth. Next, we're going to work on lip seal and tongue traces. So from here, you want to think about your lips should always be sealed. Sometimes, again, anatomically, this can be very challenging, but I do want to encourage you to do your best because this is what's going to encourage nasal breathing. So we're going to close the lips, seal the lips, and then we're going to do lip traces. So you're going to take your tongue and you're going in a circle. Okay, and that would be one direction. We would go 5 one way, 5 the other way, and you can ultimately work up to approximately 3 minutes a day with this. So you don't have to do it all at one time, but you can start with just increasing your repetitions slowly. So this is going to help to build lip strength, tongue mobility. Both are key for nasal breathing. Next is one of my favorites, which is humming. So we're going to do humming with mini breaths. So what I'd like you to do here is inhale lightly through the nose, and then on your exhale, you're going to hum. You're going to finish your hum, and then you're going to pause for a mindful swallow. When you take this mindful swallow, again, the tongue should come up to the roof of the mouth, and you're just going to patiently wait for a calm and deliberate swallow. Humming is amazing for so many reasons. It's going to stimulate nitric oxide production. It's going to help to vibrate the soft palate and tone the soft palate, and it relaxes the nervous system, stimulating the vagus nerve. So this is a great, simple 5-minute routine that could be done once or twice a day. My recommendation is the car is amazing for these things. You will build airway tone, you'll improve nasal breathing, you'll set the foundation for better health. So think of it like brushing your teeth. You're doing this except for your airway.